Welcome to In Case You Missed It, where we take 3 healthcare stories you probably missed and explain why they matter before someone on Facebook explains them incorrectly. Story number 1, the FDA and peptides. So, an FDA advisory committee has voted to recommend allowing 6 unapproved peptides, some of the most popular ones out there right now, to be used by certain compounding pharmacies. Cue the internet declaring the FDA just legalized peptides. Except they didn't. They did not. The committee's vote is only a recommendation. The FDA has not made any final decision, and adding a substance to the compounding list would not mean the drug is FDA approved. It doesn't mean it's proven safe or even proven effective. In fact, FDA scientific reviewers recommend against all 7 peptides being considered because of limited clinical evidence, insufficient safety data, inconsistent formulations. Supporters argue that regulated compounding could be safer than forcing consumers into the online gray market. Critics argue that allowing widespread sales without strong clinical trials could destroy the financial incentive, there it is right there, to ever conduct those trials. So the real debate is not simply peptides good or bad. It is whether access should come before evidence or whether doing that turns patients into unpaid research assistants. Story number 2, IRS mileage rate. So the IRS has made a very rare mid-year adjustment to the standard mileage rate. So beginning back on July 1st, business mileage rate increased from 72.5 cents per mile to 76 cents per mile. Few important reminders. This is an optional tax calculation rate, not a universal law requiring employers to reimburse employees 76 cents per mile. It also does not apply to your normal commute. Driving from your house to your regular workplace is still considered personal commuting, even when the commute makes you question every decision that led you there. But employers that reimburse business travel should update their policies and payroll systems, and self-employed workers should keep accurate mileage records. Third and final story is 2 Americas and 2 hospital systems. So Yale researchers found that between 2001 and 2023, 644 hospitals closed while 502 opened. That's a net loss of 142 hospitals, and the hospital beds per 1,000 residents declined in every single state. But the more troubling finding may be where those hospitals are moving. So nearly 3/4 of the new hospitals open in the wealthiest 40% of counties. In other words, America is still building hospitals. We're just building more of them where the payer mix is better, commercial insurance is more common, and patients are capable of absorbing deductibles. Why is commercial insurance so important to hospitals? Because commercial rates individual health insurance, your employer-sponsored health insurance, the reimbursement rates are much higher for those policies than they are for Medicare and Medicaid. So each individual hospital decision may make financial sense, but collectively the system is beginning to look a lot like healthcare redlining. Okay, shiny facilities opening near growing affluent areas while poorer neighborhoods and rural towns lose emergency rooms, maternity care, and one of their largest employers. That's a key part of it. And that's the uncomfortable reality of the American healthcare system. Sometimes the market is working exactly as designed. The problem is it's not designed around the patient. That's what you missed this week. Check me out on Instagram at Healthcare Bill for all of these type of videos. Thanks so much.